Guidon and our Pepper team, our construction team, have built a cardboard city of a lot of the different areas that we have been working on designing over the last year, really, to be able to see the space and bring first-line caregivers into the space to be able to see it. I'm always a big fan of getting the people who are actually doing the work, having a say in how we design the space and how we're going to perform the work in the future, so that's been really valuable. People have been very complimentary of this process. Being able to see it on paper, it's hard to know, how much is 600 square feet, but when you get into it and you can kind of look around and decide, what really it can go in the space, where's it going to go, has really just been eye-opening for so many, and we've made a lot of significant changes with the room layouts and how we're going to design different areas to be most successful for our patients and caregivers.
The efficiency is for the team, caring for the patient. You want things close and easily accessible, so making sure you have things, even your storage rooms for equipment, or just in the room, having, where you're going to position that computer. Is it going to be on wheels? Is it going to be stationary? Where will the family sit? Well, that's been the funnest part, is just being able to walk into an actual room and to see, okay, there's the head wall, there's the bathroom, there's where the family will sit, and so it's nice to see, what it will look like as you bring a patient through the door, on a wheelchair or on a cart. So that's been the funnest part of just being able to see the vast areas.
Do you want gloves?
Yeah, where do you want gloves, sanitizer?
Yeah, I always tell people, I'm like, there's never. Sure. Yeah.
Depending on the style of clock, yeah, probably. Because I don't know what that clearance is quite yet.
We've mocked up probably 50 to 60,000 square feet within this existing building. We've used probably 3,000 yards of cardboard. And just mocking up that amount of space is a huge effort.
Get a digital representation of what's built here. We'll share that with you guys, and then all of the hospital will go live together.
It is incredibly exciting, to come to fruition. We've been talking about Westfield for a really long time, feels like a long time, and it's actually moved very quickly. The construction team under Jeff Caesar's leadership and Julie Christopherson, they've done an amazing job of bringing a variety of different key stakeholders into the loop, helping us to understand from an administrative perspective what it should look like from a clinical perspective. We've had providers here, respiratory therapists, just a number of people, and I couldn't be more excited about what we're going to be able to bring to the community. We are so excited about it because we have a lot of frontline caregivers that are actually taking care of patients both from an OB perspective and a NICU perspective. So they're able to go into the rooms, understand how best to provide the best patient experience, but also the best caregiver experience. And so it's just really important for us to have a key group of stakeholders that are part of this experience.
And if so, we can do it. So we were in one of our LDRP rooms, and we were having a mom labor, and it quickly turned into an emergency section. Exiting the room, heading towards our main OR. So we called out to our team, and we had a bunch of hands come in, and we prepped the mom for an emergency C-section.
To take the bed out.
Okay, we're scrubbing her abdomen, getting the catheter in.
So we went into our C-section suite and completed a emergency section. Our NICU team was already there, ready to receive the baby.
Okay. Baby. We're going to take great care of Susan. We'll get you over there as soon as we can.
And provide NICU care and resuscitation if needed. And then we had nursing care there for the mother.
Julie, as part of the OR equipment, do you have transfer boards?
Plus Delta, what went well on that last